The REACH concepts include awareness, communication, education, and environment. Awareness begins how we identify these patients when they arrive to our departments or our units. One way is through self-identification, using signage that patients can see when they walk onto the unit. The signs that we have available say, "Welcome to Nemours Children's Health, where we reach to make your visit the best possible experience." We realize that not all children process their environment in the same way, and we strive to meet the needs of all children. Please let us know if your child has any of the following conditions so we can best accommodate them during their visit. This includes sensory, developmental, or behavioral conditions. It lets them know that we have headphones to block noise and other sensory items available. Another way that we can identify these patients is through screening by our associates. In the EPIC environment, there's a question that populates that states, does the patient have any sensory or developmental needs? If the associate clicks yes, this will trigger a symbol that will populate on their patient list or on their care compass. This screening should be asked of all children who are 2 and up. As mentioned before, the symbol will populate on their trackboard, patient list, or care compass. Another way that this can be visualized is through a storyboard BPA. It also includes a hover feature where you can hover over the storyboard or the symbol, and it will show the responses to the family questionnaire, which we'll talk about soon. Another way that improves awareness of these patients on our units is to use a door hanger. These door hangers say reach at the top, and they say decrease stimulation, including sounds, lights, and touch, approach the patient calmly and smoothly, limit the number of associates in the room at one time, and see the patient's care team if any questions. When we are working to identify these patients, it's important to avoid implying that the child might have a condition if the parent denies any problems. You can still provide necessary accommodations without a diagnosis. Some parents may not want to say anything in front of their child about their diagnosis, and parents often do not consider these conditions as medical problems. So when you're obtaining their medical history, they may not mention that the patient is nonverbal or has autism or has speech delays or similar. And we know that children with autism, sensory issues, or similar conditions do not look or act a certain way. Regarding communication, we're going to talk about how we communicate with other associates, families, and patients. This is the questionnaire that we use across the system to individualize care for our patients. How does your child communicate? Are they nonverbal? Do they point? Do they use single words? What are the communication strategies that you use? Do they use a special communication device? What makes your child anxious or upset? When they are upset or anxious, how does your child respond? What comforts your child? In the past, what difficulties has your child had coping with medical experiences? Is there anything else you'd like to add that would be helpful to know about your child? This questionnaire is paramount to individualizing care for these families. When you're communicating with the patient, if the child is agitated or anxious, you want to give them space. Avoid talking or touching them. Let them acclimate to the environment first and decrease stimulation overall. Speak directly to the patient, even if they're nonverbal. They do understand more, oftentimes, than what they can express. Keep your voice calm. Minimize words and touch. Avoid multi-step questions. You might have to wait for an answer as it could be delayed, and you definitely want to lower to the child's level, but might not get into their personal space. How do we adapt the environment to meet the patient's needs? You can create a sensory-friendly environment in any department that you work at Nemours Children's Health. You can adjust the lighting in the room. You can use a projector. Also be aware of alarms or harsh sounds, including monitors and machines. You can provide soft music using the music maker inside of the Reach box, or even the Blue Monkey Planet on the TV if that's available in your area. You want to consider the amount of people in the room at one time. Be aware of texture issues, the feel of the hospital gown, the ID band, the pulse ox. You might need to be creative to adjust for these. And be aware of noxious smells. In certain areas of Nemours Children's Health, you might find rooms that were already created to be sensory friendly. Even if you do not have access to these rooms or a Vecta machine that can make a room sensory friendly, as I mentioned, you can create the sensory friendly environment by adjusting the lighting and using a projector. Here are some other examples of what you might find in rooms at Nemours Children's Health. The REACH program has always been supported by associates. This is a way that you can make a difference for kids with sensory, developmental, or behavioral challenges at Nemours. Through the Associate Giving Program, you can make a one-time donation to the REACH program, you can make recurrent donations through payroll deduction, or you can even sponsor a REACH box for your department. You can use this QR code to do that, and you can email us at reach@nemours.org to let us know if you've sponsored a REACH box, and we'll happily deliver it to your department and include the education that's needed, as well as signage and door hangers if that's what you prefer. If you have any questions about the REACH program, you can contact the Child Life Department, you can contact myself, or Kimberly Zalewski. You can also email reach@nemours.org.